I believe it was a prayer, praying. That's what Q set the challenge as. Is that right, Sharon? It was a prayer, wasn't it?
Yes.
Yes, it definitely was, Natalia. Sorry, I'm just seeing a few things on the screen. If we're not ready to screen share yet, can we just hold back on the screen share, please, David? Thank you. Thank you. Yeah. Yes, definitely. Last week's challenge was about our getting to know God, and it was set by Q. I believe Q's in here. Would you like to remind people what the challenge was, and then we can ask them to unmute and let us know how they got on with it? Are you in here, Q? Are you able to unmute? If you can't, then you can't tell me that you can't unmute. Okay.
Maybe we could see, Sharon, if anyone took on the challenge and what that was like. Should we open up the platform for everyone to share their experience this week?
I'll just remind people what the prayer was. It was basically, for those who don't know God, it was, dear God, please, I don't know you. Please reveal yourself to me and help me to know you better. And for those who already do know God, or you already have a relationship with him, again, it will just be, dear Lord, please help me, please reveal yourself to me better. So, and that was a prayer that Q had asked us to pray on a daily basis for this week, and just to see how it went. So over to our audience. Is there anybody who did this? Even if you didn't do it for the whole week, maybe you did it once or twice, or if you did it every day, then just let us know how you got on with that prayer and the results.
Oh Lord, not again.
Are you able to unmute everyone?
Yes.
So is that somebody there that was going to share something?
Let's see if there's any comments, if anybody's saying they can't unmute. No, there's none of those. Okay.
Well, it's Emma here. I did do the challenge for the whole week and I feel better about it. I feel good in myself. Yeah, I've seen some changes because I have a difficult time at work, and I did do the prayer silently, and it helps me to reflect back on God and his promise that he will never leave us nor forsake us. So that's my challenge, and I've done well.
Amen.
I think I've done well.
Well done, Emma. Praise God for that.
Praise God, Emma.
And did it help you to feel that God was closer with you?
Yes, I feel him a bit closer. Because for what is happening with me at work at the moment, and saying the prayer silently every time I walk in the room or walk out of the room or enter in the school gate or leave in the school gate. I even say it when I'm at home. And I feel good. It's really helped.
Fantastic. That's good. That's really good. Thank you for sharing, Emma.
Thanks. You're welcome.
Natalia, do you think anybody else may have?
Anything to share? Let's see. Is there anybody else that's got anything that they'd like to share for their experience this week? What's it been like for you? Our lovely Emma just shared something, and we're grateful to hear that, her experience this week with the Lord, and it'd be nice to see if anyone else has had any more experiences.
Okay, whilst people are thinking about what to say, oops, my device keeps going. I keep letting people in the room and then it makes my device go funny. Whilst people are thinking about that, I can give you an example of, it's not quite the challenge, but it's an answer to prayer regardless. I do a ministry with young people in teenagers, and then we have a Zoom platform where we come on every week and we share Bible study together, and we go through the relevance of it in our lives and in their lives. Obviously, we've got a bit of an age gap between me and the teenagers, but hey, you know, I once was one. And there was one girl who was dropped off our platform, and for most of the summer we didn't see her, and I was wondering, how are we going to get in touch with her? How are we going to? And I prayed about it and said, look, God, I need you to help us to get this young person back on the Zoom call. And I couldn't find her details anywhere. I tried calling her dad, I couldn't get through to him, or I was sending him messages, but it's like he wasn't able to read them. And then one thing said to me, just go through your contacts. And I was going through my contacts and I saw a message that I'd had from her way back in probably July time, and sent her a message because I thought maybe her number stopped working. And lo and behold, I got her. So I was so grateful to God that he'd answered that prayer, and she was back on with our team last week. So that was fantastic. So that's one answer to prayer.
Lovely. See, God really does answer, don't you, Sharon?
Definitely,
He does answer.
definitely. Not always in the way you expect it, but
Mm-hmm.
he still does. Anybody else got an experience of trusting in God? That was the final T in New Start.
They're quiet today.
Good
Okay.
afternoon, everybody. Hope all is well.
Good afternoon, Stuart. Is that our Stuart?
And let me show you my face.
Hi, how you doing?
I'm good, thanks.
Long time no see.
Yes, all is well. I didn't really follow the challenge because every so often I'll be off and on based on the time factor and so forth. But generally, I appreciate prayer. Obviously, you know, I'm overseas, so I really miss my family and close friends and so forth. But on a personal note, every Wednesday, my family, we pray for each other as well as pray for wisdom and direction. So that's been really sort of like supportive, not being able to see them in person and so forth. But also, you know, when there's sad tragedies in your family, I pray for I was praying for my nephew because his baby was premature. So the whole family was praying for him. And God is good because now they're out of hospital, they're at home. And God, you know, God sort of like makes miracles happen. And we know that if we truly trust and believe in him. So that's just a small part of my testimony to the platform.
Thank you so much for that, Stuart. Really appreciate that. And he is definitely in the healing business. So if those of you who are concerned about your health, trust that God, you're concerned about your health. God is definitely concerned because I'm checking I'm not muted, because he loves every one of us. And so therefore our well-being is of great concern to him. And of course, he can help us with it too. So thanking God for that, for coming through with the Miller family. This week, before we go any further, we're going to ask if we can have the shared screen for the disclaimer. So I'm just going to ask if we can get that on the screen. Okay, Natalia.
Okay, guys. So only a physician can diagnose, treat, and prescribe for any illness or disease. Any information disclosed or discussed here at TTI on this health family show is just for educational purposes only. So if you've got anything wrong with you or any type of illness, still seek your general practitioner. But yes, let's enjoy the rest of the show.
Okay, thank you for that, Natalia. So today on TTI Family Health Show, for those of you who are just joining us, welcome. Thanks for joining us, and we know you're not going to be disappointed. Any of you struggling with aches and pains in your knee or your back or your hip or your elbow or anywhere where there's a joint?
Oh yes. Yes.
Okay.
Yes.
Yeah. Okay. I think there's a big yes. I can put 2 hands up. Okay. So today we are having joining with us our friend David Bartholomew, and the title of today's show is Inflammation, Arthritis, and Posture. So if we don't have any more testimonies for today, I'm going to give David that extra bit of time because we'll go into this bit a little bit earlier than usual. It's just after 3:10, and we may be able to have some testimonies at the end if anybody wishes to share with us how they got on with the challenge. And we also have a new challenge for you this week as well. So without any further ado, I'm going to ask if you can mute your devices unless you're presenting, and I'm going to ask David if he can begin his presentation.
Good afternoon, everyone. Good afternoon. I don't know if you can see me. My screen is just showing a blank screen for some reason or other. So I don't think anybody's going to be able to see me, to be honest with you, unless I come out and then come back in again. Unless everybody's just happy for me to just talk and then you just see my screen and that's it.
No, David, I think we'd like to see you. So if we don't mind, everyone on here, David's just going to nip out and zoom back in again.
All right.
He'll
Okay.
be doing a little bit of a flying act.
I'll be back. All right.
I've heard those words before. Okay. Right then. So while David's gone, right, let's plan this. No, I'm joking. Okay. So, it's an opportunity for anybody else to share how they've got on with any of the other challenges, not just the one that we set last week. Previously, we've had ones where we've had mobile. Oh, that was a hard one. The social media fast. It was more difficult for some than others. And then we also had the going to bed early. So anybody, if you'd like to unmute, there's probably about 25 different challenges, or even more than that we've set over the weeks.
Now, mine is a question.
Who's that? What's your name?
Joshua.
And Joshua, where are you calling from?
From Reading.
Okay, Joshua.
Yeah, I started taking zinc, MSM, and vitamins D and vitamin K too. How long should I take it?
How much are you just having the zinc tablets?
Zinc, MSM, vitamin K, and vitamins D.
Okay, right. Going back to the vitamin K, that's the one that we recommended that you took whilst you were having your vitamin D, because it helps to absorb the vitamin D. And whilst you're in a place where you don't have much sunshine like we are today, we went for a beautiful walk. It was nice and relaxing, but there wasn't an awful lot of sunshine. So in the winter months, if you're in the Northern Hemisphere, a cold country, then you will want to boost your vitamin D and have the K to go along with it to help your absorption. With regards to vitamin C, if you want to, it depends on your reasons for taking the extra vitamin C. If it's for general health, then by all means keep taking it, because even if you take more than you need, it will just come out as you urinate. So you won't overdose on vitamin C. What else did you say you're taking? Zinc. MSM.
Yeah.
Is there anyone else on here that would tell us a bit more? Because I don't really know all the benefits of MSM. I just know I don't like the taste.
Karen, I take the MSM. MSM and vitamin C, you just take a really small quantity of it. So I just take half a teaspoon of the MSM, half a teaspoon of the vitamin C. I was taking it for my skin and my hair and my overall health, but it's actually really good for your joints as well. So that's another thing from today when we learn about bones and arthritis. MSM is fantastic for that. And all those who want to grow some hair, MSM is great for that as well. With the vitamin C, the two must come together because the two of them work together for your hair, your skin, and your overall health. So I hope that answers your question.
What is MSM, please?
It is an organic sulfur, which is basically extracts from a plant, from plants. So it's got a long name. I don't know if anyone can pronounce the actual name for it. I'm not even going to try. And
I can disappear and just get the tub.
yeah, if you can get it, yeah. It's just got a really long name, but it's an organic sulfur from plants. That's what it is. It's really bitter in taste, but it's really, really good for you.
I'm back. Okay, so there's the where's my camera? There you go. Can you see it?
Yeah, that's the one. Yeah.
Right. So it's methyl sulfonyl methane. Okay. Now, thank you for sharing that, because I didn't know that you're supposed to take it with vitamin C.
Yeah.
And it wasn't until after I took it I realized that I took too much, because I had a really nice smoothie that I'd made with Sharon fruit and mango and blueberries and blackberries and some coconut yogurt. And then I thought, this tastes really nice. I think I can risk putting MSM in it. And I put more than a teaspoon. It didn't taste nice, but I didn't need to take so much. So now I know. Thank you for that, Joan. You've given us some info how to get hold of some MSM. You want to see that again? If you look on the chat, Joan has posted the link to, or a link to MSM. I'll show you the tub again though, if you really want to see it. There you go. I don't know if that's back to front to you, because I can't really tell.
Oh, no, it's all right.
What has she said on the chat?
Sharon, I've forgotten to mention, you know, the other things that are happening in the week as well. For anyone who's new here, or those who are regulars, we do other things in the week. So on a Tuesday evening at 8 o'clock, we do a study hour where we look at the spiritual side of health and the actual and health combined together. That's what we do on Tuesdays at 8 o'clock every week. And we also have a WhatsApp group for women's health and men's health, and a spiritual group as well. If someone in the admin chat could post that, that would be great. On a Thursday, Brother Alvin and Shirlene come together and they share the benefits of essential oils for our health. So you're all invited to come along there as well. We do that on Zoom. I think it's at 6 o'clock.
When was that? Sorry. When was that one?
That one was on Thursday at 6 o'clock. Essential oils.
No, Tuesday for the
8 o'clock one.
The essential oils.
Yeah.
No, Tuesday's the study hour.
Yes.
Oh, sorry. Yeah.
Thursday for the essential oils.
Yeah.
I'm sorry, because I'm just like new to the group. I usually get on with Shirley. You know, like the guys from Wales on Zoom.
Okay.
With them, and sorry, you don't know my face, and I don't know any views. But I've just seen this on today, and I've suffered with osteoporosis in my knees. Which, praise God, it's hardly very painful. I take vitamin D, but I'm just hoping to get lots of good tips off you guys. So that's why I came along today. And I'd like to be more involved. Yeah, it sounds brilliant, a brilliant group. Thank you for sharing.
What's your name?
Lynn. My name's Lynn.
Thank you for joining us, Lynn, and I pray you will not be disappointed. And as Natalia said, MSM is good for joints as well, so that's one thing I forgot. So yeah. But don't take too much of it.
Vitamin C. Vitamin C.
With your vitamin C, that's right. So is David back in?
Yeah, I don't know. Yeah. Sorry, my I don't know if it was my computer but I can't get the camera to work at all.
Can I just ask you what Thursday one was for the essential oils? Sorry again, what time?
6 o'clock.
At 6 o'clock.
6, okay.
UK time.
Okay, yeah. I'm in Newcastle upon Tyne, the cold end of England.
Okay.
So you need some vitamin D.
Yeah, slots.
Yeah. Okay. Okay, then there is also a link in the chat for the live YouTube, because understandably not everybody has access to Zoom. So if you have a friend who wishes to join us, there is a link, a YouTube link that's shared in the chat. You can, if that can be posted again, because I know people are still joining us now as we speak. I'm letting people in now. There's 2, 3 more in the waiting room. So yeah, if we can share that again, the link to the YouTube live. So we've got the WhatsApp groups, Women's Health, Men's Health WhatsApp group, the YouTube, and the Bible study WhatsApp group as well. Yeah.
How do you get onto that? If it's WhatsApp, how do you get onto it? Because I've just discovered Zoom since we've been locked down for the first time. I'm a 69-year-old lady, and I'm just kind of feeling my way around things. So how would we get onto the
WhatsApp?
YouTube? WhatsApp, sorry. I mean, I've got WhatsApp on my phone, yeah. So what do I do actually to?
So,
Sharon,
yes.
sorry, it's Shirlene. Regarding Pixel 3a, I don't know your name, but I've
Lynn.
left you my number in the chat, so you can contact me and I'll send it to you straight away, and I'll let you know how to get onto the group, the ladies group.
Okay, thank you. Thanks.
You're
very
welcome.
much.
So it's in the chat, my number.
The chat. How would I get into the chat? Oh, you see what I mean? I'm not very good with these things.
Okay.
I don't like you young things.
Towards the bottom, it will say more, and then it will say chat.
Okay. Yeah.
Okay, so thank you everyone for sharing with us. Lynn, we love to have you on here, so we're looking forward to engaging with you more. And we will pray that David's camera comes on if God wants it to happen. If not, we can still see your screen, so, and we can thankfully we can hear you as well. So if we've got no further comments to make at this time. Okay, someone said, what about the men's group? Can we have a link to the men's group on there as well in the chat? If one of the admin can sort that out. Thank you. We've got enough on there. So yes, David, if you're ready to unmute, it's now 3:24. So over to you.
I'm just going to try and use my phone.
Okay.
Just gonna do that. Let's try that. Okay, can you hear me? Is there any feedback?
The feedback has ended now, but what you could do is you could email your press.
All right. Can you see me now?
Yeah. Yeah.
Right. Okay. So what I'm doing is I don't know what's going on with my my computer. The camera just done something very strange in that it's not. Oh, just getting some feedback now. This is crazy, isn't it? Let's see if I. Right. Can you still hear me? Yeah.
Yeah.
All right. Good. No feedback.
No.
Okay. Good. Right. Okay. So I'm going to share my screen on the computer. Bear with me while I do this. There's a lot of confusion going on here, man. But that's all right. God is good. Okay, so what we're going to do. My name is David H Bartholemew, and I am a physiotherapist, external, what they call it, an extra scope, as it were, practitioner, and a lymphedema specialist. Okay, well, my main area really is focusing on the feet, the knees, hips, pretty much the whole body. And there's some various other areas that I get involved in, such as dealing with strokes, head injuries, respiratory problems, pretty much the whole body, and like podiatric sort of activities as well. But that's just what I do. But you know, in the main, I'm a sinner saved by grace. Okay, so what we're going to do is we're going to get into the sharing of the screen. It says here, host disabled participant screen sharing. I've got two links on here. So the computer one, if you could get me to share the screen, that would be great. All right. Okay.
Well done, David.
Fantastic. Right. Okay. So here we are. We're going to be looking at today inflammation and arthritis and posture. Okay. Right. So I'm going to go to the first screen. So what is inflammation? And stomach is inflamed. You know, it's almost like I like to play around with words, you know, in and flamed are basically the syllables of that word. And so you can see that, you know, in a situation there, you know, dealing with like forest fires or a fire in a house, it's not a very comfortable position or situation to be in. You can look at those diagrams and all you can think about is heat. Yeah. And heat, when it's uncontrolled in terms of you receiving it, is not the most comfortable experience. So that's, you know, in effect, that's what tends to happen with joints when they become inflamed. So what I'm going to do is we're going to move on to looking at that word inflammation. So what is inflammation? The words that come to mind: burning, scorching, hot, swollen, painful, loss of movement, damaged, and poor function. Now, when something becomes inflamed, it normally is coupled with, obviously, with swelling. And swelling in and around any joints in particular, number one, it's painful. And pain is a number one inhibitor of movement. And also the actual swelling in and of itself prevents the movement because the dynamics of the joint changes. And because of that change, the amount of movement available usually at that joint is compromised because of the different pressures that are enhanced at the joint level. Okay. Now then, it's interesting because, you know, I was wondering whether the Bible speaks about inflammation, and it does. When you look at Leviticus chapter 13, verse 28, it says, "And if the bright spot stay in his place and spread not in the skin, but it be somewhat dark, it is a rising of the burning, and the priest shall pronounce him clean, for it is an inflammation of the burning." Okay, so again, that word burning, like we saw in the diagrams that we saw initially, present heat and burning. And that word's being alluded to in the Bible there. Deuteronomy 28, verse 22. "The Lord shall smite thee with the consumption, and with a fever, and with an inflammation, and with an extreme burning, and with the sword, and with blasting, and with mildew, that they shall pursue thee until thou perish." So again, you know, the Bible is very clear about what inflammation is. It couples it with burning, and that tends to be what occurs when an individual has inflammation. There tends to be a warming of the joint, irritation of the joint, aggravation of the joint. Okay, so when you look at the word inflammation in the Bible, it comes from this word, tesorebeth, which basically means a scab, scar, or sore. You know, those are the words in the feminine: burning or scorching. Okay, so when you look at the word inflammation, you'll find that it tends to be the bedrock of the majority of diseases that we are susceptible to. Okay, and effectively, what you find is that things such as inflammation, multiple sclerosis. Again, inflammation is an issue that presents. Motor neuron disease. It's the anterior horn cell of the spinal cord that becomes inflamed, that becomes damaged, and then it wreaks havoc with the motor nerve or neural system of the body. Cerebral vascular accident, otherwise known as a stroke, again, whether it be via a clot or whether it be via a bleed, it enhances the inflammatory process, and it's the inflammation that does damage. Parkinson's disease is a type of inflammation that affects the subcortical region of the brain, okay, otherwise known as the substantia nigra, where a lot of your dopamine is produced, which helps to mediate nerve sort of information that leaves the brain by an area called the reticular activate system, which is in your brainstem. But we'll not go into that. But effectively, that's what causes that problem there. Chronic fatigue syndrome, again, inflammation, fibromyalgia, inflammation. The research shows, if you were to go onto med.com, you'll find that inflammation is quite inherent within dementia. The worst inflammation is, the worse the dementia becomes. Asthma is predisposed. It's again fueled by inflammation. Ankylosing spondylitis. I don't know if anyone's heard of that. I'm sure you have. Again, inflammation. Flu, colds, lupus, ulcerative colitis, type 1 diabetes, allergies, chronic obstructive pulmonary disease, COVID-19. It's a hyperinflammation that occurs with that. And it's also known as a cytokine storm. All right. Which again, inflammation is the bedrock that enhances and encourages that. And it's because of an ineffective system or immune system that would encourage that to be even more perpetuated. Psoriasis, atherosclerosis, mental health, again, increased by inflammation, osteoarthritis, and rheumatoid arthritis, which, you know, this is a subject matter that we are going to be touching on. But all of these aspects, all the diseases are encouraged by inflammation. And this is, you know, anything that, you know, the more, as we know, the more acidic your body is, the more acidotic your body is, the more pronounced inflammation is, and the more susceptible to disease you become. Okay. All right. So moving on. Okay. You can unmute yourselves if you would like to answer the question. Which one of these sort of like pictures would you say appears to be inflamed? Do they look all right there? Do they? What do you say about this one? Does this one look inflamed, or does that look okay? Would you say inflamed or normal?
Inflamed.
Inflamed. How about this one here? Any ideas? Does it look inflamed or does it look normal?
It looks normal on the face of it, but you're going to tell us it's inflamed.
No, that one's normal. What about up here? This one's like feet out of the car window. Do they look inflamed or do they look okay?
It's not a trick question, is it?
Nope.
I'd say normal.
Okay. And this one down here is kind of obvious, really.
Do you want me to answer? Okay, inflamed.
Well, inflamed, right. Okay, so really and truly, when an area is inflamed, you know, it's difficult to miss. It's difficult to miss unless, you know, there's an individual has, you know, maybe a slightly or a bit more on the overweight side, as it were, or carrying a lot of weight around the area. But even so, you can still distinguish that the area is inflamed. Okay, right. So looking at these knees here, can you kind of see which ones are inflamed? These ones in the middle here, do they look all right, or do they look inflamed? What do you reckon?
Looks good.
Looks good. This one over here.
Looks terrible.
And here.
Likewise.
Yeah, and this one. So you get the idea. Okay, I hope it's not my phone playing up. But anyway, so again, you can tell when something's inflamed. It doesn't look normal. Okay, it looks bigger than it should do. Okay, and in a lot of cases, you can get an increased erythema, which is reddening of the area. Yeah. Okay. All right. So moving on. So again, the same principle applies. You can see that you can see where there's normality, and you can see where there is inflammation. Okay. So this is what tends to happen within arthritic issues. Now you're looking at a diagram of a joint here. This is a typical joint, sort of a diagram of a typical synovial joint. Now synovial basically means that it has synovial fluid in it. So you can see here, this is two ends of bones. Yeah. Okay. This is like the more of the ball portion of it, the convex and the concave. A typical joint like this would be like your finger joint. Yeah. Okay. So in here we have your synovial membrane, which lines the joint. That is responsible for producing synovial fluid. Okay. All right. So the fluid that's in here is produced by this membrane here. And the more movement you have at a joint, the more it stimulates the these synovial membranes to produce more fluid. Okay. So you have a fibrous capsule that encloses all of this and holds it all together. All right. Okay. And in the joint cavity, you can see where this is the synovial fluid here. And this region here, you have what they call hyaline cartilage or just cartilage. Okay. In around this region here. And obviously you have the bones here. So that's what a typical joint will look like. Yeah. Okay. So now we're looking at some stages of osteoarthritis. Okay. So osteoarthritis, you can see the first, you've got grades 1 to 5. So that'd be 1, 2, 3, 1, 2, 3, 4. Sorry, grade 4. You can have grade 5. Grade 5 basically means you absolutely need to have a replacement of some sort. Yeah. All right. So I'm just going to pan this up. Sorry, I'm trying to move this thing around. Okay. So you've got minimum disruption in number 1. Okay. It says here there's a minimum of 10% cartilage loss. So that is the beginnings of osteoarthritis. Yeah. Okay. All right. And here again, it's continuing on. Now, it's not really depicted on this diagram as well as it should be. However, you can see up here, there's some cracks beginning to form in the actual hyaline cartilage, right? Okay, so joint narrow in space. So this space in between here, whenever you look at an X-ray, if this area in between here becomes, it will appear as a dark space or a gap, a black space, yeah? But it's not empty. It's actually filled with fibrocartilaginous substance and also your hyaline cartilage. The smaller this space in here, the more wear and tear you have. So the closer these bones come together, the less joint space you have, the more irritation that will develop and the more inflammation. Okay. Now, when you get to grade 4 or grade 5, which grade 5 is really, really bad, but grade 4, you can see here that the joint space is really substantially reduced compared to grade 1. Okay. And what's happening is that the actual cartilage has gone down to what they call the subcartilage region. Yeah. Which means that the area of the cartilage, which is beneath the thickened cartilage, but it's very close to where you have a lot of nerves in your joint sort of surface. And so when that begins to happen, you start experiencing pain and even more inflammation. Okay, so this is where it says joint space greatly reduced, 60% of the cartilage has already lost, and large osteophytes. Okay, so these bits here, you can see these bits, these kind of jaggedy bits here, those are what is known as osteophytes. So they're bones that kind of like bone that's been laid down in adverse sort of like, positions, and it's as a result of the wear and tear. Okay, right. So again, here's another look at OA knee. Okay, and this knee is you can see this knee looks a lot worse, really. So there you have it. Grades 1, 2, 3, and 4. Okay. Now you have a difference between osteoarthritis and rheumatoid arthritis. Okay. Does anybody know the difference between those two at all? Any ideas? Hold on just a minute. Any ideas? Okay. Well, basically, they both end up in what we call a degenerative arthropathy. Arthropathy just basically means a joint that's gone bad. So pathy means it's problematic, and arthro means, or pathy means dysfunction, and arthro means joint. So in effect, it means a joint dysfunction. So whenever you see something with pathy at the end of it, it means that there's a dysfunction going on, or it's gone into a bit of a disorder, pathology. Yeah, right. Which means things have gone out of the normal sequence of things. So neuropathy basically would be your nerves have gone wrong. Yeah. So anything pathy attached to it, that's what it means. So when you look at the osteoarthritis, it's normally due to wear and tear of the joint, poor posture, poor muscular activity that contributes to the wear and tear. With the rheumatoid arthritis, it's more of an autoimmune disease whereby your white blood cells, they begin to attack the joint surface or the joint lining, particularly the joint capsule. All right, so around this sort of area here, that's what becomes inflamed. Okay, all right, and it goes through fits and starts of being inflamed. So you get like a period where it is exacerbated or it's worsened, and then it will calm down, and then it will exacerbate again. Okay, and it seems like it does it for no rhyme or reason. But there's a reason for everything, isn't there? But eventually, what happens is the joint becomes so eroded, so broken down, that it becomes like an osteoarthritic joint. Yeah. So osteoarthritis will be termed a degenerative arthropathy, and rheumatoid arthritis will be termed inflammation arthropathy. Yeah. Okay. So, and obviously you can see there's a normal knee or normal joint rather, and here's an osteoarthritic joint. Okay, the joint space has been reduced. You can see here, joint space. The interesting thing about osteoarthritis and rheumatoid arthritis, though, is that rheumatoid arthritis doesn't necessarily affect weight-bearing joints. It has a tendency to affect the non-weight-bearing part of the joint. Whereas osteoarthritis, it affects the weight-bearing part of the joint. Yeah. Okay. So moving on. So you can see here the progression of arthritic tendencies. Okay. So here you have normal, healthy. This is like osteoarthritic, and this, you can see that looks really inflamed, don't you? That's a rheumatoid arthritic joint. But you can see that both have that degenerative look about them. Okay, this tends to diminish, and this tends to broaden and widen with the weight-bearing joints, as it were, in osteoarthritis. Okay, so again, it's just to give you an idea of the progression of the rheumatoid arthritis. You see here, you've got the immune cells in here. They basically start attacking the joint, the lining of the joint, and this becomes inflamed. The cells infiltrate and they cause damage, they cause inflammation. All right, okay, and so here towards the end, you see inflammation, immune cell infiltration, hyperplasia, which means increased thickening of the lining of the layer of the pannus formation. What that means is like you get almost like invaginations occurring in the joint. So it basically begins to filter. It filters into the joint. You know, that's what happens with rheumatoid arthritis. Okay, so these are some examples of individuals who've got rheumatoid arthritis. Some individuals, however, have rheumatoid arthritis and they don't have any form of deformation at all to their joints. Yeah, but it's just that some people do. Okay, so you have early rheumatoid arthritis, intermediate rheumatoid arthritis, and you have late rheumatoid arthritis. You can see the deformity, how bad those joints have been attacked. Okay, moving on. So what's posture got to do with all of this? Well, effectively, when you get rheumatoid arthritis, it just knocks your posture way out. Yeah, okay, and causes major issues. All right, okay. But with osteoarthritis, if you look at the posture, you can see here that this individual has got poor posture. We would call this like a flat-backed posture. Yeah. And this one over here, we'd call this one. This is poor posture. We call this like sway back posture. So they're hinging around this area here, in loads of increased pressure here, and cause problems. Okay, and then we have what they call a normal or good posture. So when you look at like a flat back posture, okay, flat back posture, an individual could be predisposed to disc problems with a flat back posture. And people with flat back posture, they tend to have tight hamstrings that cause a problem, you know, okay. What you don't want to do is, like, you know, get into a position whereby your posture remains sort of stuck in that position, because, you know, you have a new skeleton every 7 years, and that the posture can determine the position that you get stuck in. Yeah. Okay. Somebody who has ankylosing spondylitis that we mentioned earlier on in one of the previous slides would have a posture kind of like this one here. And it really does affect, it can affect the breathing as well. Your posture does have a big effect on your breathing capabilities. So, you know, if you want to be able to inflate your lungs effectively, then try and make sure that you keep your chest nice and upright. Okay. And try and maintain this particular position here. I don't know what's going on with the screen here. Some weird stuff coming up onto the screen.
Sorry, someone's drawing on the screen. We just need to disable that.
All right.
We just need to delete it and
I thought it was my computer. I thought, what is going on?
But I think only you can do it because you're screen sharing.
All right. Okay. I don't know how to delete this. Yeah, I have no clue. It's all right. I'll carry on anyway. But let's let me see if I can. That's my previous screen. I'd have to go into the.
You just need to disable annotation.
Do I go into share screen and get rid of?
There's I think there's some dots that you can click on, like for more or something like that, and then if you click on that, I can't remember exactly how to do it, but then you disable annotation, and then you can also delete. Have you found it?
So yeah, disable. Right, I've done that.
And then you should be able to delete what they've put on there as well.
Hide names of annotators. No. Hide. Copy stream. Record. It doesn't say anything about getting rid of them.
Okay, there is a way. If one of the other admins can come on, unmute and just say, I've forgotten how you do it. I've not done it for a while.
Screen. Yeah.
Just stop the share document and do it again.
All right. Okay. Okay. I can see where it says annotate. Oh, hang on. Okay. Let me see. Yeah, something's come up. Bear with me. Get this out of the way. Thanks.
Someone's just saying there's an erase button beside annotate. Just
Yeah, I've got.
erase button and try to erase it.
There you go. There you go. All right, happy days. Does that look clearer now?
That's great, and nobody can mess about with the screen now. You've disabled annotate.
Cool. All right, excellent. Right, now then. So going back. Okay, here we are. Right, so 7 effects of bad posture. Yeah, damage to vertebrae, damage to joints, spinal discs, pain in the back, neck, and weight-bearing joints, prevents lungs from fully expanding, makes you look less confident, makes you look shorter, makes you look heavier, negatively affects your overall health. Okay, so that's what some seven effects of bad posture. Okay, and so you have the good and the bad, so like presentations of posture. So here we have, it basically helps with issues with the shoulder. It reduces problems with the shoulders. Okay, reduces obvious problems with the lower back, and it helps to keep the pelvis in a good alignment, and helps to keep things orderly, and also helps to reduce any adverse pressure on the knees and the feet. So this posture here, you can see it can affect the base of the neck, can affect the muscles in the neck, can affect the breathing, cause back problems, cause knee problems, and so on. So I'm not going to go through all of the details, but that's the sort of thing that that can be brought about because of bad posture. Okay, right. So just looking at, say, for example, knee problems. If anybody's got any knee problems, there's some exercises that you can do. They're called inner range quad exercises. And this is a reasonably good exercise to do to try and help to balance the knees, balance the knees, the muscles in the knees, in particular the quadriceps femoris. Okay, you have 4 sets of muscles in the knee. You have, or rather the front of the knee, you have the vastus medialis, vastus lateralis, and you have the vastus intermedius and rectus femoris. So those are the 4 groups of muscles to the knee. And if you do these sort of exercises, it will help to keep a good balance in the kneecap, and also help to reduce any wear and tear in the knee region. Okay, that's just a little tip there for you. Okay, again, this is another way of doing the same exercise. So you can see the person's lifting the heel up, okay, and they're basically tightening the muscles in the thigh, and that helps to encourage the muscle on the inner aspect of the leg to work a bit more effectively, because that muscle doesn't necessarily get worked when you're actually doing your daily activities and so on and so forth, because you tend to use the knee in what they call the mid-range of movement and not the inner range of your movement. So nobody really walks around straightening their knee like that person straightening their knee on that rolled up towel there, if that makes sense. Yeah. Okay. Lunges are a very good exercise to help to support and strengthen your back as well as your thighs, but the buttock muscle gets worked here. That feeds up into your lower back and helps to support your back and to reduce any pains or problems that may present in the lower back. So people may have heard of spondylitis or spondylosis, which is basically arthritis of the spine. So whenever the doctors or your GP said to you, "Oh, you've got spondylosis," it means that they're saying you've got arthritic changes in the joints in your spine. But this is one way of actually trying to prevent that from occurring, yeah, or to reduce the effect of it. Going on to the next slide. Now, your shoulder blades, okay, are quite important to help to facilitate good posture, okay? Right, now, I just want to try a little, keep it. A nightmare with this thing. Let's see. What a day. Hang on a second. I'll put this up so it stays. 1 second. There we go. All right. Okay. Right. So what I want you to try and do, yeah, is to try and lift your shoulders up like this. Okay. Can you manage that? Try and lift your shoulders up. Okay. So this is what we call elevation of the shoulders. Yeah. Try and drop your shoulders down as much as you can. Okay. Good. Now, when you drop your shoulders down as much as you can, that is a good exercise for you to do, because most of us have our shoulders up, and that can actually build up tension in around this area and also cause a lot of buildup of pressure and tension in the neck, which can set up what they call trigger points, which can travel up into the back of the head and into the back of the eye and cause loads of problems. You see, people who have like whiplash injuries get a lot of issues in around the upper fibers of trapezius. So the best thing for you to do to try and reduce any tension in that area is, number one, to drop the shoulders down, or even hold on to the arm or the bottom of your chair, or put your hand underneath your bottom and just take your head across to one side, like so. And that helps to stretch this area out. And if you held on to the bottom of the chair and leant over, that's another way to really help to stretch this area out here. Yeah. The other thing is, if you can keep your shoulder back and down, so you pull the shoulder down and you push the chest out a little bit, maintain that position and try and lift your arm up and down. Okay, so your shoulder's gone back and it's staying down, and you're just moving the arm out back and forth. That's a good way to try and practice using your arm, particularly if you're using computers and stuff. Because if you're using computers a lot, say at work or at home, what happens is you can cause this tension to build up here, cause your neck to protrude, cause problems at the base of the neck. People tend to develop what they call a Dowger's hump, yeah, which is a buildup of tissue and the bone at the base of the neck, and it can reduce the range of movement available in your neck and cause all sorts of problems. Nerve problems and repetitive strain injuries can be as a result of that as well. But it's very important to try and keep your shoulders back and down, not too far back. So you pull the shoulders back as far as you can and release off about, say, 50%. And that's really where you should be. And that will help to sort of like, you know, really prevent a multitude of sins with regards to your upper limbs. How much time have I got? I know I'm rambling on.
David, somebody was asking, I know you were demonstrating and I can see it in the little square on the bottom, but not everybody was able to see that. So they just wanted you to just possibly like unshare screen and then share it back when you're coming back to your presentation.
Sorry, say that again.
Maybe if you unshare screen and then share it again when you come back, because not everybody was able to see you doing that.
I'm with you.
Or
Okay.
maybe the screen's
no,
too
I'll
small.
do that. Remind me.
You're asking me to remind you?
Now I'll probably remember. All right. Okay. I'm gonna carry on. I'll do it. I'll do it at the end. Promise. Yeah. Okay. All right. Okay. So we're gonna move on now. Okay. So this is another exercise, what they call retraction. See, that person's got like a band in their hands, and what they're doing is they're actually moving their hands outwards. Okay, outwards in this direction, and they're pulling that TheraBand. It's a TheraBand or a stretchy band, and pulling their shoulders. The shoulder blades are coming together. Can you see that? That makes sense. Again, this helps to reduce overactivity of these muscles up here and helps to enhance the activity down here, which we are so sort of like, you know, we don't have that activity as much. Everything's based upon the upper fibers trapezius. These are the majority of times that people who do office work and so on and so forth, and driving jobs and computers, they're coming for problems with this issues up around here and up around here and up around here, because this area here isn't working as much as it should do. Yeah. Okay, so you can see here, these are the lower fibers of trapezius here. Lower fibers are here. You've got middle fibers here, and you've got the upper fibers. Upper fibers are here. Okay, so these are the ones that get overworked, and these ones don't get worked at all. But this guy seems to be doing okay. All right. Okay. Now, types of medication that are basically given for things like to help to reduce inflammation and so on and so forth. Some of these you've probably heard of them: coproxamol, dihydrocodeine, paracetamol, ibuprofen, Voltarol, gabapentin, Oromorph, tramadol, morphine, methotrexate, gold injections, aspirin, Selexkib, diclofenac, indomethacin, corticosteroid injections. All of these things some of these ones over here tend to be sort of like, you know, NSD, non-steroidal anti-inflammatories, and these ones over here, a bit, you got some like steroidal issues going on over here. But they basically come with their side effects to your body because your body doesn't necessarily recognize them. They do help to reduce your pain, but it's like, you know, if you have the long-term effects of those things, you can get all sorts of problems. We know that codeine is renowned for constipation. Constipation is something that can really mess up your system in a big way, causes auto-intoxication, but we won't go into that. Which, okay, well, auto-intoxication increases acidosis, and acidosis basically encourages disease even more so, right? So that's something that needs to be borne in mind. But yeah, these come with side effects, which aren't the best scenario, okay? So what sort of foods help with arthritis? Well, garlic, natural anti-inflammatory, broccoli, walnuts, berries, spinach, grapes, olive oil, tart cherry juice. These things help with you know, natural things help with arthritis. I mean, sometimes it will take a little while for it to begin to take effect, you know, but I tell you the other thing about arthritis, yeah. Arthritis is worsened by muscular weakness, okay? Your muscles are responsible for supporting the joint. Sorry, I'm looking at the wrong camera. I keep on looking at my computer. So what happens is, if the joint musculature is compromised, more of the stress is placed at the articular joint region, and that increases friction. Friction increases irritation. Irritation increases inflammation. Inflammation increases pain. But if you're able to strengthen the area, all right, then that will help to reduce the friction, reduce the pressure at the joint level, and it will help to reduce the irritation, reduce inflammation, and help to reduce the pain, in conjunction with, you know, so like natural foods and so on and so forth. But you know, there are other foods that help with well, have anti-inflammatory effects, like turmeric is another thing that can help to reduce inflammation. Even carrot juice, was talking earlier on with Sister Natalia, and potato, you know, potato poultice can help to facilitate that. A cabbage poultice also will help to reduce inflammation. Okay, the main thing with inflammation is that you need to try and reduce the pain. If you can reduce the pain, you can start to use the joint more effectively, get the muscle working, and by so doing, you increase the strength of the muscle and help to support the joint and reduce the irritation. That's really the main emphasis. There's a lot of people that have come to my clinic, come to our clinic to see me, and you know, they've been sort of put in a position to actually to have a replacement, a joint replacement. And after we've finished with them, you know, there's no pain in the knees, and they haven't had to go and have a joint replacement. And it's a fantastic result. So there's a lot that can be done.
We know him.
Yeah? A lot that can be done.
We know him.
So
rice.
Rice.
Oh.
So talking about rice, talking about food. Okay, so here's some minerals that help with arthritis. Okay, calcium, chromium, copper, folate, which is B6, vitamin C, vitamin D, vitamin E, vitamin K, iron, magnesium, selenium, sodium, vitamin A, vitamin B12, 1, 2, and 3. So all of these things help to facilitate and to help to reduce the prevalence of arthritis. Okay. All right. So there's some following nutrients which actually help to reduce inflammation in a big way. Black cumin seed, Nigella sativa, is one of the most powerful anti-inflammatories on the earth. That's natural. Okay, that's natural and doesn't give you any side effects. Okay, one of the most powerful anti-inflammatories. Okay, so that's one way of getting your hand, getting some reduced inflammation. It has many other, as you can see on this chart here, it helps to reduce a lot of issues and helps to reduce a lot of problems. Okay. Which is really, really very, very effective. I've used it. A lot of my patients have used this, and they swear by it. They say, I'm not going to have anything else. I'm not going to use anything else. I'm just going to use that, you know? And I mean, patients have, they've basically just left the clinic, and they've not had to come back to me, which is a bonus. Okay. So that's Nigella sativa. Okay. The black raspberry seed, extremely good. It's exceptionally rich in antioxidants. It basically helps to reverse damaging effect of free radicals. So it's an antioxidant, and it's really helps with the body's functions and eliminating harmful toxins and so on and so forth. So the black raspberry seed, it helps to fight and prevent cancer, and so like allergic acids. It basically helps to break up fatty tissue, and it helps to prevent formation of tumors. It's really very, very good stuff. And you wouldn't think this about black raspberry seed extract. You wouldn't think it at all. But God is good. All these things help to promote and encourage health. It's fantastic. Chardonnay grapeseed, again, it's another fantastic anti-allergen and anti-inflammatory. And my wife has a cousin who's suffered with hay fever, and he started taking a compound, a product which has this stuff in it. He used to suffer with hay fever in the summer and in the winter, and after taking this compound with this stuff in it, it's made all the difference. He's got his life back. No longer hay fever sufferer. So it's got antioxidants, vitamin D, vitamin E, vitamin C, flavonoids in it, and which are antioxidants, preventing and fighting against cancer, detoxifying the body after chemotherapy, if you've ever been affected by that, regulates cholesterol, improves brain power, and prevents cognitive disease, fights free radicals, and improves immunity, which is something that's really, and improves your complexion even. So, I mean, this really helps to fight against the war of inflammation. Aging is actually connected to inflammation. It kind of stands to reason, really. So that's Chardonnay grapeseed. Okay. This stuff here, it's like, resveratrol. It basically helps to inhibit the growth of colorectal cancer, protects against oxidative damage. This is what the grapeseed actually facilitates. And all of these, it helps improve all of these issues here. AIDS regulating non-transmitters in the brain barrier. People start to use this stuff, and it's helped to reduce prevalence of things like dementia. It relieves constipation. It helps to inhibit virus expression. So again, COVID-19 that we're in, this would help to facilitate, preventing that. I'll tell you a story if I've got time to later on about that sort of issue. So yeah, that's the one other thing. D-ribose. Okay, so this is basically what is contained in this particular product, and it helps with your ATP level. Yeah, which is one of the powering chemicals that your body makes. So it stores energy in this, and so this basically helps to facilitate your body and getting going, and gives you energy. And again, D-ribose is a 5-carbon sugar, so it doesn't affect your glucose index. Yeah, it actually it helps to reduce the prevalence of diabetes, type 2 diabetes, in fact. All right, so these things, I mean, they really are. It's really, really very effective. Okay, all of these things, yeah, you find them. A lot of people in this day and age, they don't have time to sort of get the extracts of these things and so on and so forth, and put it all together. But you can actually just get it in a package in this form, in 1-2 ounce bag, which is really quite effective. If you're on the run and you're on the go, you can get it. But then it's still Sabbath hours anyway. But I'm not going to go too much into that detail. But cranberry seed, again, this most nutritious part of the seed. Most nutritious part is the seed, and this is contained in this in this product. But you know, the thing is like, this is what these oils in the cranberry seed have: high levels of polyunsaturated and monounsaturated fatty acids and phospholipids, phytosterols, and large amounts of antioxidants. Now, this is quite an important part, because these are like omega-6, omega-3, omega-9 oils. Your joints are crying out for this, whether you got arthritis or not. Your joints are crying out for this stuff. Now, just to give you a little, if you imagine a cell, the cell has got a membrane. Yeah, the membrane basically is made up of omega oils. Okay. Now, if you take it into your system like rancid or bad omega oils, well, guess what? The cell membrane is not going to work effectively. So every single component of your body, including your joints, has cell membranes. And your cell membrane is responsible for allowing oxygen in and carbon dioxide out. If the cell membrane isn't functioning properly, it won't allow oxygen in effectively. And this is what cranberry seed is really, really good for, as well as sort of like, you know, urinary tract infections, because the cranberry seed basically helps to block a particular site in the urethra, and stops the bacteria, normally Escherichia coli, from getting into that area and causing UTI or an infection, which you know, cranberry is renowned for, as we know. Oh, you've got UTI, go and have some cranberry. But it's just, we've got to realize that in the seed is where the power is. You know, you think about when you have a seed and the seed is able to produce life. There's life in the seed. You know, God speaks about it in Genesis chapter 1, verse 29. But anyway, moving on. Again, kale is very potent, very powerful, and it's got one of the most highest sort of like levels of sulfur, amounts of sulfur in it, which basically is like, you know, one of those the third most abundant mineral that is required in your body in terms of digestion and absorption and so on and so forth. These are the things that help. Again, if your digestive system is functioning effectively, then your joints are going to be functioning effectively. And so it's, you know, it's very, 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 very important, you know. Moving on. Wheatgrass. We all know about wheatgrass. Fantastic. It's very effective, potent minerals and nutrients within it. It's known as what is known as a superfood. Concentration in chlorophyll. And as we know, chlorophyll, for those of you who don't know, chlorophyll has exactly the same molecular structure as our hemoglobin. The only difference is the hemoglobin has iron in the center of it, the molecule, and the chlorophyll has magnesium. That's the only difference. So all you need to do if you want a blood transfusion, get lots of chlorophyll in there and make sure you get some molasses or something to get some iron into your system to convert it into hemoglobin. Yeah, but no, it's very, very, very effective, very, very good for you, and is a very potent antioxidant. Okay, black cumin seed. Again, we've spoken about this already. Very, very good for the body's immune system. Helps to enhance your T lymphocytes and gets them working effectively. In fact, it acts as what they call an adaptogenic. An adaptogenic basically means this: it helps you to get a balance. So if you've got too much inflammation going on, it will reduce the inflammation. If you've got too little inflammation going on, it will bump it up so that it does the job to facilitate you functioning more effectively. Again, spirulina is, this is very, very good food for your body. And it helps, it really encourages the stimulation of the antibodies and boosts the liver function, and enhances good health in that region. Okay, full of minerals and vitamins. Chlorella, this is a single-celled algae, has long been eaten in numerous Asian countries and is a true superfood. Okay, it has 60% protein, approximately 60% protein, providing the same quality of protein as eggs. You get that in chlorella. So, you know, say goodbye to the eggs if you've been eating them. You can get it from this. Okay. All right. And then single Bible. Single Bible. Aloe vera. Fantastic stuff. Potent healer. Very good for the digestion and very good for the intestinal system. Yeah, it's I say aloe vera is good for everything. Yeah, it's good for everything. Okay. Dandelion root. Okay. Dandelion root, again, this helps to encourage the liver. And, you know, once you've got because your liver is your detoxifying sort of organ in your body. Okay. And if it's dirty, if it's not functioning properly, because, you know, you get if you're constipated, you're getting a fast track passage from the rectum to the liver of the contents that's in the rectum. And that basically causes you to auto intoxicate, and you don't realize it. A lot of people think that, you know, if they go to the toilet once a day and they eat 3 times a day, they think they're fine, but it's not so. You know, you are very likely possibly constipated. All right. Well, dandelion is one way of helping to clean up your liver, but you must make sure that your bowels are moving effectively as well. Okay. Things like enemas and colonic irrigation help to facilitate that as well. Okay. All right. Chlorophyllin. Again, this is another one that helps to improve. It helps to improve bad breath. So you've got issues with halitosis, well, you know, or body odor of any form. It helps to clear that up. And various toxins that are produced via the liver. It remains a key compound for improving the function of essential detoxification pathway. So again, another good liver. All of these things are found in this. If you can't get all of them at once, boom, you just get in a 1-ounce smoothie, and you know, you could just take that. But you know, these are the things that you can do to help to facilitate your body's correct functioning, and also help to resolve sort of like any sort of like maybe painful situations that you may be going through. So, you know, I've come to the end of the presentation. And as I promised, I will show you the shoulder position and so on and so forth that we hadn't spoken about. But these are my details here. If you need to any further information, or you want to find out about the things that I've mentioned, you know, getting them in one hit, you can do that by contacting myself. My name is David H Bartholemew, your favorite neighborhood physiotherapist. Okay, so right, in terms of, let me just take my jacket off. All right, I'll unshare my screen, but I don't know if it's going to make any difference because I'm using my phone, but hopefully it will. Okay, happy for me to get rid of this now?
That should be fine, David.
Okay, cool. Right, so let me stop sharing. Okay, can you see me okay now, Ish?
We can see you. That's good.
Right, okay, so effectively, what I was talking about is the shoulders. See, when your shoulders are up like this, okay, like that, it overactivates the upper fibers of trapezius here. This can cause tension headaches. It can cause pains that travel up along the side of the head and to the back of the eye, even into the ear. It can cause pains in that area. All right. Okay. So what you need to do, okay. Oh, I'm losing my camera. Okay. So what you need to do is, you see my shoulder here? Can you see that? I brought my shoulder back. I don't know if you can see that clearly. Let me turn to the side. Okay. So my shoulder's rounded, and now I'm bringing it back. Okay. Back and down. So I'll show you from the front. Okay, so shoulder, I'm pulling it back and down. Okay, so you've got to drop the shoulder, not up, but drop it down and slightly push the chest out. Okay, you maintain that position. Okay, you maintain that position, and you can lift the arm up. Okay, I don't know if I can get the camera to. Okay, so here we go. So I'll show you what it looks like with my shoulder rounded. So shoulder rounded, lifting my arm up. Can you see that? Okay. All right. So that's the wrong way to do it. That will overactivate the shoulder up here. All right. But if I bring my shoulder back and down, yeah. See, I'm more upright. Okay. And I'm lifting my arm up. but my shoulder is back. It's not here, it's here. Does that make sense? All right. And so in doing that, it helps to reduce, fantastic. It helps to reduce overactivity up here and helps to reduce issues with neck problems. One other thing I just want to mention, because sometimes the neck position, people tend to be in that sort of posture. That puts a lot of pressure here, and a lot of people develop a hump in this region. Okay, right? But what you need to do is you need to bring the chin back as far as you can, and then release off about 30%. And that's really where you should be. Yeah. And that way it helps to reduce things like joint problems, spondylitis in the neck, nerve impingement. It helps to reduce slip discs in the neck. Okay. Adverse neural tension, which is like nerves been aggravated by poor movement from the neck down into the hands. And also sort of like, it helps to reduce tension at the back of the skull as well. So these are things that can be done to help to reduce any issues. Okay, so I'm going to stop talking now. That's the end of my presentation. All right. Hope it was informative.
Thanks for that, David. That was great. You know what you said about the neck thing? I don't know. Like pushing your neck right back.
Yeah.
That feels weird though. Don't feel natural.
Right. So when you do that movement, you must, when you come back, you don't lift the head. Okay. You try and keep the chin level. Keeping the chin level, you then draw the chin back. Okay, but don't do this. Okay, so you draw the chin back as far as you can, and you should feel a bit of discomfort in between the shoulder blades if you're doing it correctly. And then you release off slightly so you're not doing this, so you don't look like a robot. Yeah, all right, and that will help to reduce excessive pressure based in the neck, and overactivity of the muscles to help to support the joints around here.
Okay, there's a hand up from Rani Power. Would you like to unmute and ask your question? Oh, he's muted. Are we able to unmute him, please? One of the admin, if possible.
I've done it.
Yeah, thank you. I have these shoulder pains, the upper back shoulders, like the upper scapulary region, especially when I wear lead apron and I'm bending forward and retracting. So there's too much of pain on this upper shoulder regions at the back.
You radiotherapist, are you?
And no, I'm a scrub nurse in the theater for the neuro, but we have to wear lead aprons at time.
Yes. So it's a bit of an issue there, really, isn't it? It's almost like a work-related discomfort. But the best thing that you could do is this. Number one, strengthen the upper fibers of trapezius. Okay, so you may want to do exercises like drawing the shoulders up like this. Yeah, 4 sets of 10, but you must couple it with stretches. So you're sitting on your hand, and you're taking the head across to one side. Okay, hold it for 30 seconds, do it 10 times, 3 times a day. But the other factor is that when you are wearing the leather apron, you need to try and bring your shoulders back and down, okay, and maintain that position, because what's happening is like, because of the weight of it, it feels like it's dragging you down, and that could be because of possible muscular weakness, as it were. And that's why I'm saying do these elevating top exercises, but coupled with a stretch. But when you're wearing the apron, ensure that you bring your shoulders back and down and maintain that position whilst it's on. That way, you won't overactivate your upper fibers of trapezius and aggravate them and cause static pooling of blood, which causes the buildup of toxins, which is responsible for the buildup of pain and myofascial trigger points in that area, causing you the discomfort that you're experiencing.
Yeah, because the trouble is you got to bend and you're sucking and you're holding the instruments and you're doing a lot of work, so you just can't.
Yeah, well, you see what it is. Well, you've got to, it's called scapulothoracic setting. Yeah. So when you're bending forwards, as long as your arm isn't at 90 degrees, yeah, as long as your arm is at 90 degrees, if you're below 90 degrees, you can retract your shoulder and keep the arm straight. Okay. Because all too often what happens is our arms go forwards like this and we're holding on to whatever it is we're doing, and we're over activating this area here. But that position like so, if you can see, I'm bringing my shoulder back and down and I'm keeping my arm up at the same time. Yeah. So it's just learning the art. So here's one way that you can do it. Yeah. Because it's difficult to kind of like visualize in your mind. If you can get your right hand or your left hand up behind your back and feel with your thumb for the point of your shoulder blade. Can you feel it? Now you pull your shoulder blade back and down. You've done that?
Yeah.
Keep it in that position. And now lift your arm up whilst your shoulder blade is kept back and down. Don't allow your shoulder blade to move forwards. Keep it in contact with your thumb. It feels a bit strange.
Yes.
Right? But that's what you need to learn to try and do to try and reduce overactivity of this area here. And so when you're bending forwards, okay, and you're dealing with things, if your arm isn't above 90 degrees or 80 degrees, if it's lower, then you can actually retract your shoulder and keep it down. Because obviously with your shoulder blade, when you lift your arm up, it actually helps to facilitate the movement of elevation. Okay, so it has to move. But when you're below 90 or 80 degrees, you don't have to lift up your arm. You don't have to allow your shoulder blade to move forward. It can stay down. And so if you do that, it will help to reduce the activity up here. The reason why is because this muscle here and the muscle down in your back, the lower fibers of trapezius, are diametrically opposed. So when one contracts, the other one has to relax. And that will help, as I said, to reduce the possible tension building up in the shoulder. Also, warmth to the shoulders will help as well.
Thank you.
Okay.
Thank you very much, David. I hope that answers your question. Now, before we take any more questions, Natalia, how much time do we need for the demo at the end? Natalia?
Dropped on mute. Sorry, Sharon, I didn't realise I was on mute. Probably around 10 minutes.
Sorry, how long?
10 minutes.
10 minutes. Okay, so we've only got another 20 minutes for further questions. And before we ask any more questions, thank you again. Thank you so much, David. That's been so informative. Who would have known that all these herbs that we have an abundance of can help us with our joints, you know, arthritic pains and stuff like that. So that's been amazing. People have been asking, can they have access to the slides? Just to remind you that we are recording the presentations and you will be able to access them on YouTube or via our website. That's truetempeраnceinternational.com or truetempeраnceinternational.org. It is in the chat, but yes, you can access the presentation in its entirety.
I can send the slides. It's not a problem. If anybody wants the slides, I can send them to them. That's not a problem.
Okay, and David has given you his contact details as well. So there's various options you can use. Okay, there was actually a question for Natalia with regards to MSM. I don't know if you know much about MSM as well, David, but one person did say, if I'm taking MSM with a fruit juice, do I still need to take vitamin C?
I would advise you did, but I don't know what David's going to say, but I always knew the two to work together. That's from my understanding.
It depends on the potency of the vitamin C that's within the fruit juice that you're taking.
Yeah.
Yeah.
Okay. Thank you. Right. Let's see. There's been more questions in the chat, and some hands have
There's
been
2 hands
raised.
up as well, Sharon.
Joan Lowers, could you could unmute, and then Paula.
Oh, I'm on mute. I am on mute.
That's fine. We can hear you.
Yeah. I have terrible shoulder and neck pain, and I went to the doctor, and I was told I have carpal tunnel in both hands. That's why I'm suffering from that.
Mm. Your carpal tunnel syndrome is normally something different compared to what's going on in the neck. Carpal tunnel syndrome is normally where the carpus, you have a tendon across there, which basically puts pressure on that region. There are certain things that you can do, hot and cold treatment, because it's kind of encouraging inflammation in that area of the nerves that go down to your hands. Normally it's the median nerve and the radial nerve that's affected, not the ulnar nerve. So the fingers, little finger and the ring finger tends not to get affected. I don't know if I'm having difficulty kind of like agreeing with the aspect of him talking about the neck problem and the hand. There's not normally a connection with those two. Normally.
They told me they are connected when I went to the specialist, and they did these electronic things with nerve testing.
All right.
And that's what I was told.
Right. So they did an electroconductive test on you.
Yes.
So the electroconductive test basically lets you know what's going on with regards to the passage of the impulses in the hand upwards. Normally it's if you've got issues in the neck, it's a bit of a stretch to say that problem in the neck is causing what's going on in the hand. However, you can have the situation whereby you do have possible adverse neural tension up in the neck, which can affect the hand, but it doesn't necessarily just affect those nerves that are under the carpus. It can be the ulnar nerve as well. Yeah. But the important thing is that, see that exercise I spoke about where you do a deep neck flexion?
Yep.
You draw the chin back. Yeah.
Yeah.
So do the side, drawing the chin back. That in actuality actually can help to open up just a little bit. Sometimes a fraction is just all you need.
Yeah.
Open up the apertures or the holes through which your nerves pass through down into your arms. And that can help to alleviate some of the pressure on the nerves as they're going down into your arm. If you imagine you slipping your arm through your sleeve.
Yep.
Okay. That's what your nerves kind of do as they leave your neck. But they travel through different sleeves through your arm to innervate your muscles and stuff.
Yeah.
And so effectively,
it's also affect my sometimes I'll take something up and it falls out of my hand without I realizing it. I'm having all that problem. Things just fall out of my hands. I have no strength in it sometimes.
Yeah, that's more to do with probably the carpal tunnel, because sometimes you lose sensation.
Yeah, not losing, but sometimes a little funny sensations. I have pains, not pains. There are some funny feelings,
like odd nerve pain, nerve sensations, right?
Yes, yeah.
I mean, what you could do is you could try. Have you taken medication for this? Have you?
No.
Okay. Well, I'm not. Don't feel bashful or shy about that. Well done. Yeah, because natural. I always say natural is the way if you can get away with it. Yep. But the stuff that I was talking to you about, I mentioned earlier on. It's sun is set. Should we? Are you happy for us to pray to close Sabbath?
Yes, we can do. Not everybody on here are Christian, but we can do that. We can do that.
Yeah.
We can do it. Is that okay?
Yeah.
All right, we'll just say a quick word, shall we? Let's pray.
Okay.
Loving Father in heaven, we thank you so much for the Sabbath that you've blessed us with. And all those who aren't aware or know about like the Sabbath and so on and so forth, or Christians, we ask, Lord, that your blessing will be upon them, and that the information that they have received will help to facilitate restoration of health in them. Lord, it is your desire that we prosper and be in health, even as our soul prospers. So I pray that every person under the hearing of my voice will be able to receive this blessing that you have in store for them And not only that, but in some way be able to be brought to the place where they could be fully made whole in all aspects of their lives. We thank you for the Sabbath, and we ask, as it closes, that we enter into a new week, that, Lord, it's untried, but we ask that you'll keep us. In your precious name we pray, amen.
Amen. Thank you.
Right, so yeah, so as I was mentioning, it's like, the individuals, I know one patient of mine had what they call chronic pain syndrome, chronic regional pain syndrome. Then they sustained an injury. They had major damage to their nerves and their hands and so on and so forth. And I was able to get them onto what's called Soul, the stuff that I showed earlier on. And it basically helped to resolve their problem substantially. It helped no end when I was treating them. Normally it would take about 6 months, probably even a year to kind of clear up a chronic regional pain syndrome because of the discomfort and pain and the sensitivity of the nerves. But they were able to get sorted within 6 to 8 weeks. So it was fantastic. So it's something that, you may want to consider.
Okay. Yeah.
All right.
I have your number. I'm gonna get the number, so I'll call if I need any more. Thank you very much, and may God bless you.
God's blessing rest on you, sis. All right, take care.
Thank you. Yeah.
Okay, David. I know you did put your slide up, but if possible, you could put the details in the chat as well, because some people weren't able to see the slide.
Okay.
We have a question. Before I take the question from Paula, there was a question with regards to the shoulder exercises. Is it possible to do that if you have frozen shoulder or rotator cuff injuries?
Oh,
is it advisable to do that or not?
Now there's a question. Put it this way. In terms of like rotator cuff injuries, it depends on where you've damaged the cuff, really. See, for the cuff.
Hi, David. Sorry to interrupt you. It's Paula. It's actually me that posted the question.
Okay, Paula.
Oh, so is it okay for me just to go ahead and speak?
Days.
Is that okay, days. Sharon?
Yeah, that's fine. Go ahead, Paula. That's
okay.
2 in 1.
Okay, yeah. So as I was saying, it was me that posted the question. But I have problems in both my shoulders. My right shoulder, apparently, if I've got a frozen shoulder with an impingement, and I've also got partial tears in tendons in both my shoulders. You'll have to forgive me because I'm not sure if I'm going to pronounce these correctly, but it's a supraspinatus and the infraspinatus on the top of the shoulder on the ridge. I've been told I've got arthritis in both my shoulders. Inflamed cushions and inflammation of the bursa, and something to do with the acrocricular joint or something like that.
Acromioclavicular.
Yeah.
Acromioclavicular joint.
Yes.
Also, you pronounce this very well. Yeah. Supraspinatus.
Thank you.
Well done. Supraspinatus and infraspinatus. And also, you see, the thing is with the frozen shoulder, if you imagine that your shoulder, there's a gap between your shoulder and the what they call the acromion process. That's a part of your shoulder blade that comes forwards, and attaches to your collarbone, right? Now, underneath that acromion process there, you have a space. That space is normally filled with the subacromial bursa. Okay, now that bursa can sometimes travel from this point here all the way down into your arm. Now, people who suffer with frozen shoulders have a tendency to have that area become inflamed. Frozen shoulders are an inflammation of the glenohumeral joint, otherwise known as your shoulder joint. And so if that becomes inflamed because of the pain, you stop moving it. And then what happens is that joint capsule that we were speaking about earlier on with the typical synovial joint becomes tightened up, and it basically holds the joint in a position where it can't move. And if you try to move it, it becomes painful.
Well, I do try to use both my arms and shoulders as normal, but there's times like it affects my range, especially with my right arm. I can stretch to open a window, for example, and then it's like my arm's just frozen in time and I have to use my left arm to bring my arm back down. But I've also been suffering at night because it affects me mostly when I'm lying down, when I'm trying to sleep. And despite the fact that they've given me tramadol, which I don't really want to use, but I take cocodamol, and they've given me fentanyl patches to use as pain relief, which I hate taking medication, but they're not really working, and my sleep is so disruptive, and it's been going on 3 years in March. And I was supposed to have a hydrodilatation injection into my right shoulder in March, but because of COVID, it's all been put back now.
Oh, that's that's supposed to be quite a good good method of treatment nowadays for the shoulder, because it helps to open up the joint and gap the structures. Sometimes people hear a bit of a pop when they have that injection into the shoulder, and it can help to encourage or improve the movement of the shoulder joint. But yeah, I mean, effectively, I mean, have you been seeing a physio at all? Have you been seeing anybody, or?
I've had physiotherapy in the past and amongst other treatments, and because none of them have worked, and at the time when I got referred for the injection, it had been nearly 2 years, they said I was an ideal candidate for it. But as well as getting a lot of pains in both shoulders, down my arms, I get a lot of pain in my neck and headaches in my ears as well.
You sound like you've got myofascial trigger points that have set themselves up that are causing those problems, because you become, with a frozen shoulder, you begin to overactivate this muscle here, which basically, sorry, go on.
No, sorry, I was just going to say, the questions are getting quite more like a personal consultation, which I agree a lot of people are needing, especially as we're now having more people doing what do you call those, MS Teams meetings, and because a lot of people are in that hunched up position. Our sister Rani spoke about having to hunch over when she's doing her procedures in theatres, and many have various reasons why they have to be in that kind of position, whether it's using computers or whatever it is. But if we can try and keep our questions so that it's more general rather than personal, and if you do need a personal consultation, I'm sure David's more than happy to take a phone call. Is that okay, David?
Yeah, that's fine. Yeah, I do.
I do apologize. It's just that he sounds like the only person that I've come across in over 2 years that can actually knows what he's talking about.
Okay, well, I'm glad you've been able to be put in contact with each other. But you do have his number, and we've got lots of hands. So is it okay if we refer you on for a further consultation with David? Is that okay, David?
That's fine. It's fine. I put my details in the I put some of the details in the chat, so you can get some details there.
Do you understand? Is that okay, Paula? Do you understand? There's
yes, I understand. Times of the essence. I get it. That's fine. I'll contact him directly. But thank you very much, David.
Now, I know there was a lady, Sister Smith. I think she had her hand, and you may be the last one that we're taking, because we've got a demo to do as well. So, Sister Smith, I think you physically had your hand raised.
Yes. I just want to know, how often do we take these cranberry seed and these things? Often can we take it all the time, or do we just have a limited time to take these things? And
oh, was that the thing, the things that I put up? Because I put up a few things. Are you talking about the spirulina and all that sort of cranberry and all that sort of stuff?
Yes, all of them. Yeah. How often do we take them?
Well, what it is, the suggestion is that you take them. The one that's called Soul, you could take that. You take that, and that contains the Chardonnay grape seed, the black cumin seed, the Chardonnay grape seed, the black raspberry seed. That's in the Soul. But then in the other one, the greens, where you have the aloe vera, you had the spirulina, you had the chloropella, you had all of those green sort of nutrients. That's in what they call the core. Okay, so you can take the core twice a day and the Soul twice a day. So really, it's not, what you got to bear in mind, Sister, is it Sister Smith? Is it Sister?
Yes, yes, yeah.
What you got to bear in mind is it's not medication, it's food.
Yes, yeah.
And so it's food that helps to facilitate your body's functional or effective or optimal functioning. Okay, right?
Yeah,
so you take 2 Sol a day, 1 in the morning and 1 at night, just before you go to bed. So half an hour before you go to bed. Yeah. Because of its nature, it's very. It doesn't take long to break down at all because it's in its naked, literal, naked form. So it doesn't stress your system out overnight whilst sleeping. It just gets absorbed into your system. So that's the benefits of it. And the same, well, you can have the core with your food. You don't have any thyroid problems or anything, do you?
No, I have arthritis, joint pain.
Yeah. What you can do with the Sol is that you can take the sachet, cut it open, and because of the nature of it, it's omega oils, and our skin is made up of omega oils. So you're able to actually cut the remainder, cut the sachet open and rub it on the area where you're experiencing in pain, and it draws the substance into your joints and helps to reduce pain as well. So that's really one of the real benefits of this stuff.
Yeah, I get the B12 every 3 months,
right?
But the BA and B1, B2, and B3. Can I have that often as I can?
Yeah, you can. Yeah.
Okay.
Yeah, that should be fine. I mean, it's like, we as human beings, we should have the complex, the B vitamin complex within our system. That's what helps to keep our neural tissue or nerve tissue functioning effectively. Oh, my battery.
What about the milligrams?
The milligrams, effectively, what you're looking at, pretty much is like micrograms. But all of those details, I can get those to you later on because
I can phone you then, or can I have your phone number? I can phone you.
I've put it in the chat.
Thank you very much. God bless you.
Rose bless and
God
rest,
bless
sis.
Continue the good work.
Amen. Amen.
Thank you so much, everybody. That's been a lot of feedback. Sorry, my camera's
Sharon.
Yes.
Yeah, there's someone inside the chat. There's a question that's been there for a while, and I think the person called me, and it's about tendonitis. If they can use compression socks, would that help with tendonitis?
There was
David?
Yes, there was something on compression socks, and this really has to be the very last one because we need to give Natalia time to do her presentation. And if David's available with his battery life, he can possibly come on at the end. But what was the question with regards to compression socks? It's gone off my chat.
Okay, so the question was, let me just get it quickly. I believe, can you use 1 minute? Let me get 1 minute. Just give me a second. Is compression socks good for tendonitis and swollen ankles, please?
Well, I suppose it depends on what the swollen ankles is all about. Sometimes it's difficult to say, without saying that. Say for example, if somebody's got some congenital heart failure going on, CCF, then compression socks may not be good because what happens is you get buildup of fluid in the legs because the heart's not pumping effectively. And so if you put compression socks on, you're actually going to help to facilitate that volume of blood back up to the heart, and the heart, because it's in cardiac failure, it's going to make it difficult for the heart to work to get that stuff around. That's the whole reason why there's a swelling built in the leg. That's one of the reasons why swollen legs can present themselves. Another reason for swollen legs could be lymphedema, or it could be primary lymphedema, or it could be secondary lymphedema, or it could be gravitational edema. It depends on what the reason or the cause is for the edema or for the swelling in the legs. It's a difficult question to answer without actually assessing the individual and seeing what's going on. I hope that helps. But with tendonitis, normally increased pressure on the structures on the lower limbs or the upper limbs or wherever the tendonitis is presenting itself can help to support, but again, it depends on where the tendonitis is. You know, is it the tendo Achilles that's causing the problem? Is that where the tendonitis is? Is it in the ball of the foot? Where is the tendonitis? So it's difficult to answer the question, if that makes sense. Sorry.
That's all right, David. Thank you very much. We do have people joining us on YouTube. We've actually got someone from Canada on here. And there's another person, David, what's his name? Well, basically, there's a few people that are asking if you could share your contact details. David Nicholson, if you could share your contact details. So thank you, those of you who are on YouTube. It's great that you're able to contact us, to join us. We appreciate that. So Natalia, in fact, not everybody can see in the chat, of course. If you're on YouTube, you can't see the chat on here. So is it possible to just pull your screen share up again with your details so those on YouTube can see and possibly take a screenshot, and then it's over to Natalia. Thank you so much, David, for sharing your answers with our audience.
No, it's been a pleasure, man. It's been a pleasure, man. It's been a pleasure. So yeah. Here are the details. I don't know if you can see that.
Yeah, we can see that. That's great.
Yeah.
And David is saying, God bless, people are saying, God bless you. So you are a blessing to us, you know. It's good to stay in touch with your people from a long time ago, Pete.
Yes, man. Yes, man.
Definitely. From the days of the Afro and the,
yes,
you know,
man.
I won't go there. I won't go there.
Man. Yeah, man. I leave that to my son now, man. I have to keep it low now, man, because boy, you know, it's like everything's not at one level anymore, man.
Hey, okay, let's let it go. Okay, then. So, yeah. Thank you so much. I believe that's long enough for people to get the details. I can see there's some more hands, but we have another presentation now. So if it's of a personal nature, do remember you do have David's contact details, his email, his website and his phone number, and you can follow on. If it's a question for the team, the admin, we have the WhatsApp groups as well. So don't forget, we will stay in touch with you in the week. So Natalia, are you ready for us?
I am ready. Are you guys ready?
I have to shoot off now because I've got some delivering some food for some people in the community. Yeah, so I got to shoot off now. But listen, God's blessing.
Bless you. Thank you so much.
Bye, David.
Thank you. Thank you, David.
You're welcome. Bye now.
So we'll just need you to unshare your screen, David, and then we can share Natalia's. Thank you so much. Bless you.
Hi, everyone. I'm Natalia. I really enjoyed that presentation regarding.
Is that okay? Yeah.
Yeah, that's fine. Thank you.
Thank you. Bye.
Bye.
Sorry. Sorry for interrupting.
No, it's fine. Yes, guys. So I'm here to share the benefits of carrot juice. Right. So, seeing as we've been talking about bones and inflammation, I thought, do you know what? Why don't I share the benefits of carrot juice with you guys? Okay. So, first of all, when we look at these carrots, what do they remind you of? Hey, does it look like legs to you? Does it remind you of maybe your bones? That's where I'm kind of going with this. Carrots are really good. They're a really good source of calcium, and they're great for your bones. And regarding what David was talking about today, okay, guys, carrots are rich in vitamin A, okay, which produces something called beta carotene, which is fantastic for your skin, guys. So any ladies on here, seeing as we're in lockdown as well, why not be drinking carrot juice and just put the makeup to one side? I'm telling you guys, if you drink this stuff once a day, your skin will just start looking amazing, right? Don't judge me right now though, because I haven't been drinking it, but I went off and I got some nice organic carrots, guys. Yeah, not too expensive. We'll talk about that later on when I finish the presentation, but I got some organic carrots, right? I'm going to do some juicing in a minute. I'm going to share with you guys all the benefits of the carrot juice. So yes, the vitamin A, great for your skin, great for your hair, great for your overall health. It helps to flush out toxins in your system, okay? And it prevents inflammation, right? So any of these people on here today, anyone here today that's been suffering with arthritis and joint pains, carrot juice is absolutely great. You want to start getting some carrot juice in your diet, guys. Another thing that is great about carrots, right, is your vision. Is so good for you to be able to see. It improves your vision by getting carrots in. If you look at the carrot, literally like with nature, like if you look at this carrot, as you can see, it actually looks like your pupil. I know that it's not very clear for you guys to see, but the next time you got a carrot, just cut it in half and have a look, and it's just like, it's literally like your pupil. So it's really, really good for your vision. It also helps to lower cholesterol, yes, which is great. So it's a really, really good thing to get into your diet. One thing as well, guys, I bet you didn't know, as I was doing my research today, I learned something new. Yes. Anyone who gets sunburned really easy, if you start drinking carrot juice, it can help with being a replacement for suntan lotion. I didn't know that about carrot juice, but it's really, really good for that. My own personal stuff with carrot juice, guys, when I was pregnant, I was recommended to drink carrot juice because it produces really good milk for your baby. So if you guys know of anyone who's pregnant, introduce them to carrot juice. It's not only just good for women, but it's good for men, it's good for babies, it's good for children. This stuff is just really, really good, right? So anyway, enough of me talking. Let's get juicing, guys. So we'll get juicing, and then I will share a little bit more afterwards. Right, guys, I hope this is clear. It looks clear. So I'm going to get my carrots in. I've already washed them. I've washed my carrots already, and I just cut them up into pieces and put them in the juicer. Not only is it good for you guys, it actually tastes nice too. Like, I like carrot juice. I've decided to add a little bit of ginger in here too, because ginger just gives it a nice, you know, nice kick. So when you're drinking, it's like, yeah, do you know what I mean? Like, it tastes good. So add a little bit of ginger in there as well, because ginger's also good for arthritis and your joints and everything else. It's going to be a little bit noisy, but I'm going to just get on with it anyway, okay? So apologies for the noise. Right. As you can see, all those carrots that I just put in, you don't get a lot out of it. So when I'm having my carrot juice, I like to use about 2 bags for myself, because then I'll get around 500 millilitres, which is hopefully 2 glasses. So I'd recommend that. Let me get back to juicing again, guys. Look, guys, absolutely fantastic. Oh, yes. Look at that beautiful carrot juice. It's going to be delicious, I tell you. I'm just going to do all of it because I'm feeling quite thirsty, do you know what I mean? So I'm going to put the rest of my ginger in. We don't want to put too much ginger in, though, because it'll be a bit peppery. So I just got a nice little amount of ginger. Right, and I'm going to just do this last little bit, and then we'll get back to talking about the benefits. One moment, guys. Come on, man, you can do it. Lovely. Right, guys, so we just wait for it to stop dripping. So as you can see, it's rich and it is creamy, right? And it is so good for our bones. Really, really good. I like to call it my milk because I don't drink milk, to be honest. I drink carrot juice instead. But yes, guys, should we have a little taste? See what it's like, how it's tasting. Let's just move this juicer out the way a little bit. Yes, guys, so let's have the verdict, eh? Ah, delicious and nutritious. Yes, guys. So as I was saying, carrot juice, amazing. Amazing for your skin, amazing for your bones, amazing for lowering your cholesterol, amazing for flushing out toxins, amazing for your vision, for you to be able to see, amazing for breastfeeding, amazing during pregnancy. It's like there's just isn't really anything good about carrot juice. The only thing is, if you go absolutely mad on carrot juice, like I'm talking like drinking like liters and liters and liters, like say like 3-4 liters a day, which is so many carrots. I doubt you'd be drinking that much. It can actually turn your skin orange. Yes, I couldn't believe that. But yeah, I doubt would be drinking that much. But guys, the benefits of carrot juice are endless. It tastes nice. It's something that you can give to your kids, your grandma, your husband, anyone. We can all enjoy carrot juice. It also helps with your brain function. There's research to show that it can fight cancer. We know that it boosts your immune system. It's just so good. Like, sorry, one minute, guys. Carrot juice. I hope I've sold it to you. But yes, guys, I'm going to set a challenge for you for this week, right? So this week, I want to ask you guys a question actually first before I set the challenge. Can you just think to yourself what you would spend £14 on? What do you spend £14 on in your week? Just ask yourself that question, right? Because this is to do with the challenge. So this week, I challenge you, right, to go to the supermarket or go to your allotment or go to your local farm, right, and get yourself some natural organic carrots. Get your hands on the best carrots you can find, right? Get your hand on some carrots, and I want you to juice every single day. I want you to drink some carrot juice, a glass of carrot juice a day. I'm saying like 2 bags basically of the carrot juice. It's so cheap as well to say it's organic. It's like £1 from Tesco or from Aldi. They sell it. Hopefully this is for people that's got a juicer as well. So I'd strongly recommend that you guys get yourself a juicer. It's going to be Black Friday sale soon, so try and get yourself a juicer. Juice is so good for your overall health. Juicing is a great way to just get all those minerals and vitamins straight into your bloodstream. So juicing is just great for everyone. Try and get yourself a juicer. Get yourself some carrots. Buy 2 bags of carrots per day, which equals 14 bags of carrots for the week. And get some carrot juice down here. See if you notice any differences in your joints. See if you notice any difference in your skin. It helps to remove wrinkles, guys. Like, it's just so good for us. It's great for babies, for your breast milk. Yeah, so that is the challenge this week. Get some carrot juice, or if you don't necessarily like carrots, you could also do the same thing with celery, or any type of vegetable. But I do think that carrots are really good to go with the theme of what we've been talking about with arthritis and bones, and stuff like that. So yes, guys, that is your challenge this week. Drink carrot juice every day, and let's just see how it goes. I'm so interested to find out you guys' thoughts on it in our next health show next week. And yes, guys, Sharon, are you still there? I know that people have been saying bits and bobs, but I can't get to fully read it properly because my camera's a bit away from my table.
Maybe
So,
maybe after some more carrot juice, it will help with the eyesight then, Natalia.
Yeah, maybe it will. You're right, you know, like in the beginning when I first started tasting carrot juice, I was like, oh, like I was one of these people that just everything that's bad for you. I just liked everything unhealthy. But now when I'm starting to realize like the benefits, like what God's given us in nature, like it's not even that it don't taste good, like it actually tastes nice as well. It's like I've got a new taste for good things. And when you start seeing the benefits, guys, like come on.
Yes,
It's amazing.
Your palate does change, because I know growing up as a child I hated carrot juice with a passion. But yes, what helped me though was to have it with apple or pear. And I know people say you shouldn't mix fruits and vegetables because, hey, doesn't it mess up the digestion? However, because it's juice, it doesn't take long in the digestion to digest in your stomach or in your intestines. So therefore, you can actually mix, don't shoot me, you can actually mix apple juice with your carrot juice to help with making it more palatable. But if you can take it and you love it, especially with the ginger, then by all means go for it.
Sharon,
you can do beetroot, and beetroot's got it's got a whole host of wonderful for all these different things, such as your blood pressure. Mind you, carrot does help with blood pressure as well. It can help to reduce it. So, but as Natalia said, we are True Temperance International, so we don't want to go OTT with the amount of carrots that we're drinking, and it can be very sweet as well. So, if you have diabetes, again, you need to be cautious because of the sugar levels in the carrot juice. You may want to juice greens instead, so juice your green vegetables, and so be careful. But however, having said that, I don't have diabetes, and I know I have had joint pains, and by drinking carrot juice, it has drastically reduced my pain. So that is your challenge, as Natalia has said. Drink your 1 to 2 glasses of carrot juice, and let us know next week how you've got on. I know there's lots of messages in the chat. I know I can't keep up with them. Go on.
A lady's just said that she drinks carrot juice and beetroot every week, and her skin looks like she's wearing foundation.
Well,
wow, precious.
We need to see your picture. We need to see your photo, your camera, your image on the screen. But I trust you anyway. I trust you, definitely. So, Natalia, that has been an excellent demo. I had my carrots and my juicer ready just in case it didn't quite work. But thank the Lord, everything worked. And so I may as well use my carrots now and my ginger that was with it. So thank you so much, everybody. People are asking about different brands, and thank you, Shirley. You have been on that. And anybody else that's been helping out with what brands to use. It's really, we're not promoting a particular brand, so it's up to you. Just get something that your pocket can afford. If you can afford a really good one, then great. If you can't, there's some places, I'm not going to name drop, but there are some places, no, I won't say it, where you can get a good price juicer. So enjoy your juice and happy juicing, everybody.
It's an investment as well, guys. It's an investment. Like I said, that £14, I used to spend £14 on Kentucky Fried Chicken, right? And at the end of the day, this is so much better for you. This is so good for your health, right? Let's invest in our health. Let's buy juicers. Let's share juice with our family and friends when they come around. Instead of offering them, I don't know, something unhealthy, offer them some carrot juice.
Yeah, exactly. Yeah. And your children will grow to like you as well, and your body will say thank you.
Yeah,
it does. Okay. Right, so it is now, it's after 5. It's 5:10 already. So if there's anybody, I don't think we've got any time for questions either because it's 5:10, but David had lots of questions, and if there's anybody that wishes to unmute and tell us something, maybe where you're from, maybe we can take 2 questions tops maximum. Okay, but thank you all for joining us. What have you got next week? Dr. Gandhi. Dr. Gandhi's on next week, and he's
Sharon. We need to remind these guys December.
Cooking. I know that's on my radar. Trust me, that's on my radar. Okay, but next week, what's Dr. Gandhi talking about, Edgar? Heart health. Okay, and this is also good for your heart health too. So carrots can help to prevent heart disease. So it all ties in. It really does all tie in. And yes, December, we do have a cooking month, really, on the lead up to the season's holidays. And each week we're going to have a different presenter sharing with you a couple of dishes, and we may even share the recipe with you in advance so you can cook after the Sabbath. If the show comes on after the Sabbath here in the UK, you could possibly even cook along as you go along. Okay, Alvin will have more to say about that closer to the time. But yeah, we have some great presenters on for the cooking show. Yes, Paula.
Sorry, this is my first time. I'm new to the group. Somebody sent me the link, but how do you find out about all these different dates and activities that are happening?
You stay tuned, join the WhatsApp group. Thank you, Joan. Join the WhatsApp groups and we will keep you tuned. But it's every Saturday, the same time, 3 till 5.
Okay.
We're here. We've been here since the beginning of lockdown, really, I suppose, since April time. It was more men's health, and now we've gone more holistic for the family health as well, not just the men. But we have, yeah. Thank you for joining us. We have people zooming in from all over the world. Yes, Natalia.
Also, just to let any viewers, anyone else who is new, Paula, thank you for joining us. It's lovely to have you. We do other things in the week as well. If you want to keep in touch, like Sharon said, we have the WhatsApp groups that you can join, a women's one, a men's one, and a spiritual one. On a Tuesday, we come together and we share, we study the Bible and just look at the spiritual aspect of health as well. On Thursday, we look at essential oils in health. And then on the Saturday, we come back again and we do these health presentations as well. So just to let you know that as well, Paula, if you check in the chat, there'll be a women's WhatsApp group, a men's WhatsApp group, and a spiritual WhatsApp group if you'd like to join on those as well.
Okay, thank you very much.
You're welcome, Paula. And we do have our website as well, truetemperanceinternational.com or .org, and we should be updating that soon. It does, you know, we are updating as we go along, and there is a recipe on there for a lovely cheesecake, a vegan cheesecake. So by all means, come along and visit us on our WhatsApp and our website. That's what I was trying to say. So thank you so much. Trinidad told the UK about this show. Yeah, somebody did say they got an invitation from their friend in Trinidad. So that's brilliant. Like I said, it is international. It really is. So thank you for watching us. But you can now, I invite you to unmute and just say a goodbye. Tell us where you're from, but don't all speak at the same time because it's going to get a bit confusing. But you should be able to all unmute now when you're ready. And if you want to leave us, by all means, well, thank you for joining us. We'll see you again next week.
Sister Smith from Gloucester.
Hello, lovely to have you with us, Sister Smith. Thank you.
Yeah, we were invited
Paula.
by
I'm in Essex.
Someone from Essex, and Sister Smith
Paula.
was invited by somebody.
Paula from Essex.
Paula from
Romford.
Essex. Thank you, Paula.
Yeah. Bye bye.
Bye.
Sorry, can one of the admin add the groups, please? The ladies group, the men's group, and the spiritual group again in the chat, please.
Thank you, Shirley. And I know we're working you overtime. And I know there's lots of questions.
Hi, Sharon.
Hi, John.
Would we be able to just acknowledge our YouTube audience just to let them know we are about to stop live streaming?
Thank you for that, Jonathan. And yes, we have been in touch on YouTube as well. My husband Edgar's been liaising with you all. So thank you for joining us, YouTubers. And we look forward to seeing you again as well. So those of you who've missed the show or would like to share the show with a family member, we have the YouTube link. I think someone may have just put it in the chat, but we have the YouTube link. So if you joined us late, because people have been joining all throughout the show, you can go back and watch it again on YouTube or from our website. Someone's just coming in now, okay? That's all.